I tore my ACL in March of 2018 and I injured it playing softball. I collided with one of my teammates and felt the pop right away. I came to Miami Orthopedic Sports Medicine Institute because it was highly recommended by one of my friends who had a previous ACL surgery with Dr. Zvijac.
Amelia tore the anterior cruciate ligament, or the middle ligament in the knee, and what we do is we reconstitute that ligament, rebuild it, and in doing so it restabilizes the joint. And that, combined with rehabilitation, with strengthening of the musculature and re-education of the knee, they're able to go back and return to their sport.
Amelia began therapy, I believe, about a week after the surgery. It's a long process and she's actually still continuing to go through it. It starts off very slow, with just focusing on gaining the range of motion, getting the swelling down, controlling the pain, and then slowly starting to build back the strength. So you start with very simple table exercises and then progress to standing and then to the weight machines.
I'm almost 100%. I finally feel like back to how I was before and comfortable with just everyday and athletic things.
Having seen many of these over decades now get reconstructed and return to sport, I knew that she was going to have a high chance of success, and I'm very happy that she's going to be back, and I understand she's going to be back playing at the collegiate level, which is just outstanding.